The dialogue poignantly illustrates the struggles patients encounter in rural clinics, including limited access to immediate medical resources and communication hurdles during emergencies. These challenges are further intensified by environmental factors. In the midst of these stressful medical scenarios, humor serves as a vital tool for alleviating tension. Characters engage in witty exchanges about goats and payments, showcasing the power of laughter to lighten the atmosphere. As the conversation shifts to donations of medical equipment, the pressing need for enhanced healthcare facilities in remote areas comes to light. This underscores the crucial role of community involvement in bridging health disparities. The villagers express skepticism about the outsider's presence, questioning his intentions and the legitimacy of his wealth. This fosters a climate of distrust within the community. As the outsider attempts to negotiate the purchase of chickens, suspicions heighten regarding his financial motives and overall intentions within the village. A humorous discussion about the perils of rural life, including unexpected run-ins with worms and centipedes, reflects the villagers' distinct lifestyle and the unique challenges they face. Tension arises from conflicting views on medical practices and professional motivations, fostering hostility in interactions among the characters. The conversation regarding Onching Hospital highlights the critical importance of privacy and quality service in healthcare, illustrating the delicate balance between business considerations and patient care. Their discussion on a potential documentary reveals the inherent conflict between public exposure and the necessity of maintaining the integrity of medical services, especially in sensitive fields like obstetrics. Jealousy surfaces among officials when Associate President Su expresses his discontent over losing an election, consequently impacting the atmosphere during the ceremony. The youth of the new president raises eyebrows as he faces challenges in earning respect from seasoned officials. This dynamic underscores the generational divide and power struggles inherent in leadership. The presence of illegal activities, such as the sale of counterfeit medicinal wine, complicates matters further, shedding light on the ethical dilemmas confronting characters in the healthcare sector. The dialogue reflects the difficulties of working in a rural environment, where livelihoods depend on farming and animal husbandry. This emphasizes the necessity for ethical conduct within these communities. Participants discuss labor reform, suggesting that working for food represents a fair trade. This perspective introduces a broader theme concerning societal responsibilities and personal integrity. The dialogue captures the ongoing struggle between personal aspirations and communal responsibilities as characters navigate their roles within the clinic and village, highlighting the tension between individual freedom and collective expectations. Personal relationships and social networks prove crucial as characters seek friendship and support in their professional endeavors. Networking often becomes a vital resource for assistance. The emphasis on teamwork becomes clear as characters deliberate on strategies for effective collaboration. Working together is essential for overcoming shared challenges. The theme of hope emerges when characters contemplate the slim chances of success in medical situations, underlining the importance of perseverance, regardless of the odds. Taking responsibility for one's actions is highlighted as Lu Xiaoxi candidly acknowledges his past mistakes, advocating for reform. This approach sets a constructive example for others. Insights into mental well-being arise as the conversation stresses the consequences of unresolved issues, illuminating the pressing need for emotional support. Lu Xiaoxi shares the challenges faced in his professional life, including conflicts with superiors, emphasizing the intricate dynamics of workplace relationships and personal ambitions. Interactions revolving around alcohol illustrate how characters navigate stress and social expectations. This dynamic captures the balance between camaraderie and personal limits. The significance of familial bonds surfaces, especially during pivotal dates like a father's death anniversary, revealing the character's emotional struggles and memories associated with family. The character's aspirations for home ownership reflect deeper desires for stability and comfort, as they discuss plans for future housing and personal space. The villagers express their solidarity by planning to create penance in support of Yi, demonstrating loyalty despite her perceived shortcomings as a doctor. This act is designed to apply pressure on the hospital director. The dialogue reveals a personal connection among characters, emphasizing loyalty and the influence of interpersonal relationships on their professional decisions within the hospital. The conversation underscores the necessity of communication and updates within the hospital, revealing a demand for transparency and collaborative efforts among staff members. Connections in the medical field are highlighted through Ye's relationships with President Gao and President Su, which significantly impact her career trajectory. Ye's prior volunteer work in Taoyuan village illustrates her dedication and skill set, potentially opening doors for future opportunities amidst prevailing political dynamics. Interpersonal conflicts and potential romantic interests among staff suggest underlying emotional narratives that might influence workplace relationships and collaborative efforts. Dr. Ye's role as a pediatrician emphasizes the hurdles healthcare professionals navigate within community politics and personal relationships, adding complexity to her character's motivations. The importance of transparency in leadership is highlighted as the president acknowledges past mistakes made in Taoyuan Village, paving the way for rebuilding trust. Financial discussions bring to light the importance of integrity in transactions, prompting characters to reflect on their values and the consequences of their actions.